So today I'm going to be doing a indwelling Foley catheter insertion for my checkup video. I do already have a verified physician's orders. So for today, I will be performing the Foley catheter insertion on my patient Cody Taylor, age 55, date of birth 7/18XX, MRI number 0123654. This was ordered today by Dr. Ment at 0743, and we are inserting the Foley catheter due to urinary retention. All right, so now that I have the verified physician order, I'm going to make sure I have all of my supplies. I do have a Foley kit with a 14 French catheter. I have my washcloth with soap and water, warm soap and water, and I'm going to bring this over to the patient's room. Okay. So before I get started, I'm just going to verify that I have the right patient. Hi, my name is Yasmin. I'm going to be inserting a Foley catheter today, but before I get started, let me just make sure I have the right patient. All right, so here I have Miss Cody Taylor, age 55, date of birth 7/18XX, MRI number 0123654. All right, and I see you have an allergy. You're allergic to penicillin? Okay, thank you for letting me know. All right, so today your physician, Dr. Ment, ordered a Foley catheter insertion today because you are experiencing urinary retention. This just means that your bladder is not voiding out urine the way it should, and it's not voiding out completely. So what we're gonna do is we're gonna insert a like a little tube. We're gonna insert in a Foley just to help out void out the urine completely. And if you have any questions, please let me know. Okay, so I'm just going to put this away real quick. Okay, so I'm going to provide patient privacy by drawing the curtains in. I have adequate lighting, and I am going to raise up the bed. I am going to make sure that the side rails are lowered, and I'm going to make sure that the patient is comfortable and relaxed. But before I get started, I'm just going to perform hand hygiene real quick. I'm going to wash my hands for 20 seconds with soap and water. Okay, I now put on clean gloves. I'm going to take my soap and water. All right, so I'm going to draw back the sheet. Okay, and I'm going to make sure that my patient is in a dorsal recumbent position. That means that her legs are, or her knees are bent, and that her feet are flat, and that she is relaxed. Okay, so before I'm going to start with pericare. So I do have clean gloves on. Okay, and I'm going to provide the patient with as much privacy as possible. So I'm going to spread back the labia. With my washcloth, I am going to wash first the outside far labia majoris, the outside near labia majoris, the outside far labium. That was the inner near labium. I'm going to correct myself. And then this is the inner, my first one was inner far labium, and then this one is the inner near labium. All right. Okay. And then I'm going to just go down the middle towards the center, towards the urinary meatus. Okay. So I'm just going to put that aside real quick. All right, so I am going to now take off my gloves, wash my hands again with soap and water for 20 seconds. Okay, I have washed my hands with soap and water for 20 seconds. Now it's time to open up my Foley kit. I'm going to open this away from me. I'm going to discard this into my trash. I'm going to keep this for later. All right, I'm going to position it, and I'm going to open away from me to maintain the sterile field. Open the outside, and then I'm I'm going to open the sides. And then I'm going to open towards me, but I'm being careful not to let it touch me. Okay, just like that. Okay, so I am going to take this drape. To open it. Okay. Still trying to maintain sterile field. All right. So I'm going to put the drape underneath the patient's thighs with the shiny side down, just like that. All right, so now I'm going to put my sterile gloves on. I'll do it right here. I'm going to make sure I put this on within the sterile field. All right, I'm going to fix that later. My gloves can't touch the sterile gloves. Fix my gloves real quick. Okay, here are my sterile gloves. I'm going to walk over back to my sterile field, and I'm just going to maintain everything here. Okay, so I'm going to first. We don't need this fenestrated drape, so I'm just gonna throw it in the trash. All right, so I'm going to just arrange my stuff here. Okay, so I'm going to take this povidone iodine solution. I'm going to open it, and I'm going to put it all over my cotton balls. Okay. And then I'm going to take this lubrication, and I'm going to put it all over my tray. I'm going to discard that as well. I'm going to make sure that my forceps are near my cotton balls. I'm going to take my 10 ml of sterile water. I'm going to take the cap off, plastic cap off. Just going to put it in there real quick. I'm going to insert it into the tube. Okay. I'm going to take my tube. I'm going to take the wrapper out of my tube. Alright. I'm going to put it in the lube. Alright. Make sure to throw that in the trash. Alright, so I filled it completely with lube, so I'm going to put it back in the box. Just like that. All right, so I'm going to now clean my patient first with my cotton balls and forceps. So same thing, I'm going to spread the labia. I'm going to take my forceps that already has the iodine in it. All right, so I'm going to clean the outside far labia majoris. I'm going to clean the outside near labia majoris. I'm going to clean the inner far labium. I'm going to clean the inner near labium. And then I'm going to clean right down the center towards the urinary meatus. All right, so I'm going to discard the forceps. And I'm still going to hold on to the labia. And now I am going to take the box, my sterile box, and I'm going to put it between the patient's legs. I'm going to now insert the tube, the Foley catheter, and I'm going to do this sterilely. I'm going to coil the tube around my hand. All right, so I'm going to tell my patient to take deep breaths and to just relax. And I'm going to slowly insert the tube in. All right, so I'm going to insert about 2 to 3 inches. All right, take some deep breaths. You might feel some initial discomfort, but just take a deep breath until the initial discomfort has passed. I inserted in the tube about 2 to 3 inches. I felt no resistance, so I'm gonna keep going. I inserted 1 to 2 inches more. Careful not to touch the labia. All right, so I've inserted it in pretty well. I am going to now, with my non-dominant hand, I'm going to insert in the sterile water. I'm going to inflate the balloon. I will not have dexterity today. Okay, now that I have done that, I can now release my hand and I'm going to unhook it. Okay, all right, so I can get rid of that. I am going to attach the Foley using a stat lock on the patient's thigh. I'm going to place the Foley bag onto a non-moving side of the bed. Just right here. The Foley is attached on the non-moving side of the bed. All right, so the patient did tolerate really well. I am going to clean her just because there is a little mess. So I'm going to take my washcloth again. I'm just going to clean her real quick. All right, and then I'm going to pat her dry. All right, and then I'm going to make sure that I get rid of everything. I'm going to discard the stuff in the appropriate places. But before that, I'm just going to cover my patient back up. I'm going to lower the bed. I'm going to raise up the side rails. I'm going to make sure that she is comfortable, that she has her call light, and if she has any questions, just please let me know. All right, so I'm just gonna get rid of this in the appropriate container. And I will throw all of this in the trash bin. All right, and then I'm gonna draw back her curtain, and then she is all set to go. I'm going to take off my gloves. I'm going to wash my hands for 20 seconds with soap and water. All right, and then for documentation, I am going to say that The initial urine that I saw was about 200 milliliters. We used a 14 French catheter. The color was yellow and it was clear, so that was a good sign. And today is November 25th, and I performed it at 5:30. And I did perform peri-hair on the patient right afterwards, and that the patient did tolerate it really well. So that is what I would make sure. Oh, and then I also inflated the balloon with a 10 ml of sterile water. So I would document all of that. And then I am all done.